Indeed, the third wave might knock harder if people do not observe the safety protocols. Now, joining us in the studio is public health physician Nsabasi Ekanem. Good morning. Thank you for joining us.
Good morning.
And also clinical pharmacist and UN SDGs advocate Adakwe Furibe joins me now via Skype from the United Kingdom. Good morning. Thank you for joining us, Adako.
Good morning.
I'll begin with you, Adako. We can see from that report that COVID-19 is taking a dangerous turn. And the recent developments with regards to oxygen, the challenges with access to oxygen is also another major concern. Paint us a picture of what the situation is in the UK.
Well, in the UK, November last year, there was a report by the Independent that we're having a lot of admissions about patients with COVID-19 because of the winter pressure, and there's a risk of oxygen going down to lower levels. But at the moment, I've not heard any report about oxygen being not in enough supply. We have enough oxygen in the UK. There was an issue as well reported by the BMJ in December last year that the oxygen supply to the hospitals, because we had so many patients, there were issues regarding the pipes being able to supply enough oxygen because of the higher rate of admissions, but not actually that the rate of oxygen supply is low or we have low supply. So I haven't had any reports about low supply of oxygen at the moment.
All right, let's bring the conversation to the studio now. Nsabasi Ekanem, you saw that report. Shortage of oxygen was also one of the issues that was treated in that report, and we saw how the state, Lagos State, has been trying to address that. But we see that some other states have not been able to actually address this in spite of effort being put in place by the government. How much of a concern do you have? And when you are to critically look into this issue of shortage of oxygen, does it reflect perhaps that our level of preparedness to deal with the pandemic, or there is more to it?
Well, it's quite worrisome, like you've said, because we've seen that the second phase of the pandemic has brought people more patient to needing oxygen. Right. As a matter of fact, up to about 80 to 90% of patients who are infected now are critically ill and requires ventilators. Honestly, I would say that what is happening currently shows that our humanitarian preparedness and response plan was highly flawed. And I was expecting that with the first phase of the COVID-19, it was an opportunity for us to learn. I saw the progress we made. We increased from about 5 reference laboratories to about 97 reference laboratories. I was expecting that we should see an improvement in other aspects. Anyone that is dealing with severe acute respiratory infection, SARI, knows that one of the most important things to plan for is access to oxygen, because you know that most people who have severe acute respiratory infections would, one way or the other, require oxygen. Unfortunately, that plan was not there. Now, the Lagos State government is trying to respond, but the question is, what are other states doing? While Lagos State may succeed, other states are running short of supply. Like what I saw, I read a report last night from University of Nigeria Teaching Hospital. There's acute shortage of oxygen. And you can, of course, your guess is as good as mine, the fate of people who are acutely ill in those facilities. Now, when I probed further, I realized that those the oxygen plant had malfunctioned some months ago, and nothing was done. Now, the question is, how then were we prepared for a pandemic such as this? Even when we had the pandemic with us, what was then our plan as a response to this pandemic? Honestly speaking, we did not plan well and we are not doing well. And I feel that, this is a wake-up call for every state, not just Lagos State. Every state should put plans in place to ensure that we can provide what is necessary for patients to be able to get through with the COVID-19 situation.
All right, back to you now, Adako. The UK putting stringent measures to address this new variant because of the spread. And schools, some schools were locked down. There's so much stringent measures that has been put in place. How is that addressing the rise in cases?
Right. We're on a lockdown at the moment in the UK, and lockdown is helping to reduce the rate of and the spread of the virus because people are working from home. And when you go out to do your grocery shopping, you have to wear your face mask, and all the public places are closed. Things like pubs are closed, and it helps in a very big way to reduce the spread of the virus because when you're indoors, and if you go outdoors, you are wearing your mask, it all helps. And we also have the vaccination program going on at the moment. So everything is working together to help to reduce the spread of the virus. So the lockdown has helped a lot because when we had the lockdown last time, it helped to reduce the spread of the virus. But during this Christmas period and the New Year celebration, the infection rates went up again. So we're having the lockdown now, and statistics will show that the virus, that the rate of infection will be coming down gradually before maybe we reopen again. So the lockdown helps in this part of the world. Yeah, it does.
All right. I wonder if we can toe the line of the UK having a lockdown at this point, looking at the number of deaths we have recorded, the number of cases we are also seeing recorded on a daily basis, like she has pointed out.
Well, ideally, at this time, the right thing to do is to immediately initiate a lockdown so that movements can be limited. But the question is, how did we fare in the previous lockdown? Have we recovered from the heat that we had economically and otherwise? Security-wise. You saw the banditry and all other kind of nefarious acts that went on. So now, you see, there are two schools of thought. Well, as a public health consultant, I would say that a lockdown is necessary because this particular variant that we are seeing, I tell you that it's deadlier, far deadlier than the previous one. And the virulence, it spread much faster. So the right thing to do would have been to initiate a lockdown immediately. But the question is, how will Nigerians survive if we initiate another lockdown, given the untold hardship and security crisis that we had in the previous one? So honestly, I leave that in the minds of the people. But for me, I feel that there is a need for a lockdown. But then how then, as a country, are we prepared? Should we initiate another lockdown?
Issue was there were calls for perhaps shutting the borders and perhaps the airways to countries that are facing, this strain, like the UK and South Africa. There were calls, but some other person saying, no, that is not the way to go.
That's where sometimes we get it wrong. When we discovered, the moment we received the news that the new variant of COVID-19 has been reported in the UK, and we were able to get the case definition and to an extent understood the severity of that particular strain. The first thing we were told was that we should restrict movement from the UK to Nigeria. Unfortunately, we did not do that. Like I said, 2 weeks ago, a week ago, my friend, a colleague of mine, came in from the UK. So the question is, what are we really doing? Are we really conscious or sincere or honest about actually tackling this pandemic? Because when a new variant has been dictated, the best thing to do is restrict movement so that we can handle whatever we had. Unfortunately, we did not do that, and we have to now tackle this with a system that was not even able to tackle the previous one adequately. So honestly, I think
how much pressure is this putting on the system that is already strained? Like
it's enormous. It's enormous pressure. You can imagine. Almost 70, jars of oxygen exhausted overnight. You can imagine what will happen in the coming weeks. All right, given the fact that we are diagnosing new cases. So, if the pressure is much with Lagos that has already initiated, in fact, that has already worked on their plant, that plant is working in full capacity, what happens to states where they don't even have an oxygen plant? You can only imagine the pressure and perhaps the fatality that we have in those places.
And the fatality also cuts across those on the front lines as well. We have recorded a number of deaths.
Of course, doctors, about 15 doctors in Nasarawa State are already down with the COVID-19 with severe symptoms. Now, you can only imagine what would be the fate of these people. Frontline health workers are actually receiving the heat. And the least they could expect is a system that can help them to go through this condition.
Let's get back to Adaku. Adaku, you talked about vaccines. Talk to us the mode of this vaccine, how it is being, issued to people. Who are those is it the doctors on the front lines or the medics on the front lines that are the first receivers of this vaccines? What is the mode of its administration?
Yes, at the moment, we're having vulnerable patients, like elderly patients that are based on the care homes and also frontline staff. And the vaccination program, we've got screening questions. And we've got consent forms as well for patients, because we need to screen each patient and they need to sign the consent form. We have to check that they don't have any allergies, and we also have to put things in place to help with emergency periods. So the vaccination program is going on well, and we are using like a multidisciplinary approach. So we've got some volunteers, we've got nurses, we've got pharmacists, we've got healthcare assistants, and everyone is working towards the vaccination program to make sure it's a huge success. So we've got different vaccination centers in all the local areas. And also people are well covered. The frontline staff, people administering these vaccines, they are well covered with their PPE, and even the patients receiving the vaccine will also have to wear their face mask. So it's going on well at the moment. So I've not had any issues with the vaccination program. We just have to put systems in place over there in Nigeria to make sure that our patients receive the vaccination in a safe way, and it's patient-centered care as well.
All right.
Just to add to that, you see, I was speaking with somebody yesterday, and the question the person asked me was, when the vaccine comes in, what would be the criteria for distribution? Who gets the vaccine first? Do you understand? And I made it very clear that, I mean, with regards to the WHO Humanitarian Preparedness and Response Plan, frontline health workers are supposed to get it first, especially those in care homes, those that are attending to patients. These people are at the highest risk. Now, after that, we can have people with above the age of 60 that have comorbidities like heart disease, diabetes, obesity. These are the people that needs to be second on the ladder. And then we have people above the age of 60 with or without comorbidities. Before we can now consider those on the...
Do we have the data of all of these people?
Unfortunately, we do not. And I'm afraid that when the vaccine comes, the Nigerian system, honestly I must say, but you see politicians will start jumping and ensuring that it gets to their family first. But I feel that if we have a system in place, we should be able to identify these people, at least get the data available, what we have at hand. And of course, we can get this one. We have the health information system across all states. So we can be able to get the data on people who are above the age of 60 and who have comorbidity. Especially, let me put it very clear, 1 in every 3 Nigerians above the age of 60 is already living with heart disease, especially hypertension and maybe diabetes. So we can get this data and then ensure that these people get this vaccine. If you look at that video, I mean the report, you see that most of the people that you're seeing are people of older ages.
Absolutely.
It affects them more because there's what we call organ reserve capacity. Right. Your ability for your organs to, keep itself up running even when it's already exhausted. That capacity declines with age. With people of the older echelon, it is very, very likely that they will suffer severe symptoms when they contact COVID-19. So they need the vaccine first, after the frontline health workers.
Nigeria, although Nigeria, the minister says we should be receiving the vaccine sometime this month, but there are also concerns that it may not get to Africa anytime soon, perhaps later in the year. What can we do to address the gaps that you have pointed out and are also concerning? Well,
I think it's about engagement. It's about partnership, I know that from the information I've gathered so far, we are looking at bringing in about 100,000 doses and in this month, this January. And I just hope that we'll be able to get it. Now, my concern is not really about our ability to get it. We are a significant figure in Africa economically. So as much as possible, after the West, the next country that even these manufacturers will be looking at is Nigeria, in Africa, because of our economic relevance. But now my question is, do we have the ability, if we are getting the Pfizer or the Moderna vaccine, the question is, do we have what it takes to keep this vaccine? And
that has been the question.
That it is administered. I feel, if you ask me, I just want to believe that we are bringing in the other one, the AstraZeneca vaccine. Because that one, besides the fact that it can be stored in the normal vaccine temperature of between 2 to 8 degrees Celsius. I mean, to an extent, it's something that we have the facilities, right now to handle. But if it is the Pfizer vaccine, I tell you, as we speak, we do not have ultra cold fridge that can store vaccine at -70 degrees. That's a mirage. I don't think we can achieve that anytime soon. Now, if we're bringing the other one, I think it's about negotiating with these people and telling them that, look, we need the vaccine. We have spiking cases of COVID-19, and I think we have a case that we can present. And we should be able to back it up with funds so that these people can get us the vaccine and we can have our people.
But the Nigerian Medical Association has raised another concern, saying that before there has to be clinical trials before these vaccines are administered. And so I want to hear from Adaku, perhaps what stories she has heard with regards to the administration of these vaccines. It is said to be 95% effective, and that it does not necessarily mean that after receiving the vaccine, you cannot contract the virus. Adaku, are you there? All right, we'll definitely get back to her as soon as she's back on the line. Adaku, did you get my question?
No, I didn't get the question. Please, could you repeat the question?
Okay, I was saying that the Nigerian Medical Association in Nigeria is raising concerns with regards to vaccines because there has been stories across the board with regards to the administration of vaccines, stories of persons still contracting the virus in spite of getting the vaccine. Talk to us about stories you have heard, the controversies surrounding that in the UK.
Well, as far as I'm aware, just like the flu vaccine that we normally get here in the UK every year as well, before we had this COVID, the vaccination program, it's not like it's going to be like 100%, like a preventive measure, but you still have to wear your mask, you still have to do the social distancing, and you still have to use your hand sanitizer. So, but having the vaccine is very essential, and people have received that idea here in the UK. A lot of people have already had their...
When you say very essential, how do you mean then? If they still have to use the hand sanitizers, wear their masks, and it's still essential?
Yes, you have to have the vaccine, just like when you have like a measles vaccine and things like that, but you could still have measles. If we can remember, when we were little, we all had the measles vaccine, but some of us still had measles after the vaccine. So we just have to understand that having the vaccine doesn't replace the social distancing and the hand hygiene and respiratory hygiene. So that is just the way it is. We still have to carry on doing those things until we try to eradicate the virus completely. So it's highly essential that people understand that fact as well.
All right, let's bring it back to the studio now. I mean, from what she's saying, taking the vaccine, yet you still have to observe all the safety protocols. And that's the question on the lips of a lot of persons. Why do you administer the vaccine when there are still controversies surrounding it?
Well, I think it would be too early for us to conclude that the vaccine is not effective, that's why this and that. Now, to begin with, just like my colleague said there, it is just about 95% effective. And let me just let you in on a secret. The 95% efficacy that has been reported is not from the entire population that participated in the clinical trials.
Right.
In fact, as at a month ago, the data we had was just from about 194 persons out of 34,500 people that took the vaccine. So it's not conclusive, and I can tell you this for free, that in the coming months, when we analyze reports or results from more of those people, we might be able to change our standpoint. But I would say that it is already clear, and it has been made clear by the manufacturers, that the first shot of the COVID-19 vaccine does not give immunity. You need to take the second shot, which comes about 3 weeks or maybe 1 month after the first shot. That is only when you can assess how protected you are, from the vaccine. So it's important to have that very, very clear. And then, like you said, clinical trials, I don't think the company would want to, the manufacturer would want to go into that. When the clinical trials was announced, Nigerians did not participate. I want to make that very clear. We didn't participate. We should have, at least so that we can get our own data and know that, look, this thing is effective for all across board. During the third stage of the clinical trial, that is the time where the vaccine is tested among a whole lot of population drawn from different races and places. Now, if Nigerians had participated, perhaps we would have been able to have something that we can say, okay, this is the
data
efficacy,
we can work with,
say that this is what applies to Nigerians. But we didn't do that. Okay. I don't think that we can now start, going
talking
to
about
clinical.
No.
It's too late. What we need to do now, we have rising cases. What we need to do now is to get the vaccine, have people administered, and then hope that we can get the best from the vaccine.
All right. Adaku, quickly before we let you go, this myth surrounding malaria and COVID-19, talking about having the same kind of symptoms. So I would like for you to talk about that, how we can demystify that.
Well, we just have to understand that malaria is caused by a parasite, Plasmodium, and COVID-19 is caused by a virus. But both of them can have similar presentations. They can have similar symptoms and signs like fever, things like headache, loss of sense, and loss of taste and smell and things like that. But we should not neglect malaria because we're treating COVID-19. Because all we have to do is, if someone is having those symptoms, we don't just have to just say, oh, it's COVID-19, oh, it's malaria. We just have to do the tests. And we just have to do the malaria test to know if someone has malaria. And if the person has malaria, it needs to be treated. And we just have to do the COVID-19 tests as well to make sure the person, to find out if the person has COVID-19 and which should be treated as well. So we should not neglect, malaria because we are treating COVID-19. COVID-19 treatment cannot treat malaria. So we just have to, know exactly what the patient is suffering from so that we can treat the right thing. And a patient could have malaria and COVID-19 at the same time, and that patient should also receive, adequate treatment. So it's just a matter of going down to the root of the matter, rather than just looking at signs and symptoms alone to conclude. We just have to do those tests and treat appropriately.
And I'll bring it back home now, Mr. Abasi. You know how we are in Nigeria here. Nigerians, the moment they have a headache, oh, it's malaria, take paracetamol and all. I want you to touch on it as well. How do Nigerians specifically understand that it is important you do a test to get to the root of the matter?
Well, everywhere I go, every time I deliver lectures and seminars, of course, from Trinity Healthcare Foundation, which is my NGO, we do a lot of seminars. I keep saying this. Nigerians treat a lot of disease when they don't have it. Nigerians will treat typhoid when they don't have it. Nigerians will treat malaria when they, sometimes even stress can make you manifest some of those symptoms.
Right.
And when you have those presentations, you say, I have malaria. You see Nigerians abusing anti-malaria several times. But I will say this, Nigerians must learn the culture of running a test, getting proper diagnosis. And malaria test is very cheap now. With 1,000 naira, sometimes 500 naira, you can get a test done, a malaria test done. So if you are having those symptoms, why don't you walk into a lab? Now laboratories are almost ubiquitous. Walk into a laboratory, have the test done, and in less than an hour, the result is out. And so you do what? You know whether or not you have malaria. It's not just because of COVID-19, but because we have long abused antibiotics, anti-malarials. We need to stop. So we need to get the proper diagnosis so that we can know exactly what we are treating. If it's COVID, if it's not malaria, then we can probe further. A clinician can do that, probe further so that we know what it is and nip it on the bud.
Thank you so much, Public Health Physician Nsabase Kanem. Must also thank you, Clinical Pharmacist and UNSGG's Advocate, Adakwe Furibe. Thank you for your time on the program.
You're welcome.
Thank you.
Thank you.